When someone undergoes knee surgery, the first question that comes to mind is, how bad will the pain be afterward? For decades, the answer was simple: opioids. Strong medications like morphine, oxycodone, and hydrocodone became the standard way to control post-surgical pain. They worked, but at a heavy cost. Imagine waking up after surgery. You're groggy, your head feels heavy, and your stomach turns. The pain may be under control, but your mind feels clouded. That's the hidden reality of opioid-based recovery. Opioids don't just dull pain, they slow everything down. They affect the brain, the gut, and even breathing. Many patients experience nausea, vomiting, constipation, confusion, and dizziness, sometimes worse than the pain itself. And for some, the danger goes even deeper. After just a few doses, the body begins to crave more. What starts as a simple painkiller can quietly lead to dependence, tolerance, and addiction. Every year, thousands of people around the world become addicted to opioids after surgery. Not because they wanted to, but because they were trying to heal. Doctors and patients begin asking the same question: isn't there a safer way? A way to control pain without opioids, without side effects, and without fear. That question led surgeons and anesthesiologists to explore nerve blocks, targeted methods that numb only the area of surgery, allowing the rest of the body and mind to stay clear and awake. But not all nerve blocks are the same. Some can make the entire leg weak or numb, making it difficult for patients to walk after surgery. Others fade too quickly, leaving pain uncontrolled. Then came a breakthrough. A method that could block pain signals from the knee, preserve muscle strength, and eliminate the need for opioids altogether. It's called the Surgeon-Placed Adductor Canal Block. Unlike traditional blocks done after surgery, this one is performed during the operation, right where the surgeon can see the anatomy directly. In the next part, we'll explore how this revolutionary technique works, and why it's transforming recovery for knee surgery patients around the world. In modern medicine, the smallest details often make the biggest difference. And in knee surgery, one of those details lies deep inside the thigh, in a narrow passage known as the adductor canal. This canal is like a hidden tunnel that carries important nerves, blood vessels, and connective tissue through the mid-thigh. Among those nerves is the saphenous nerve, a branch of the femoral nerve which carries pain signals from the front and inner part of the knee. Now, imagine if those pain signals could be stopped before they ever reach the brain. That's exactly what the adductor canal block does. During knee surgery, after repairing or replacing the joint, the surgeon carefully locates the adductor canal under direct vision. Instead of relying only on ultrasound guidance after the surgery, the surgeon can see the anatomy, every muscle, every nerve, every layer right in front of them. Then, using a fine needle, the surgeon gently injects a small amount of local anesthetic directly around the saphenous nerve. The medicine spreads inside the canal, surrounding the nerve fibers that carry pain signals from the knee. Within minutes, those signals are blocked, like cutting off the power to a light switch. Pain messages never reach the brain, but here's the remarkable part. The motor nerves, the ones responsible for leg movement, stay fully functional. That means the patient can still move the leg, stand, and even walk soon after surgery, something traditional pain methods often made impossible. Traditional nerve blocks are usually performed by anesthesiologists before or after surgery using ultrasound. While effective, they rely on external imaging, and the accuracy can vary. But with a surgeon-placed block, precision is guaranteed. Because it's done under direct vision, right at the surgical site, the anesthetic reaches exactly where it's needed. No guesswork, no missed targets. This also allows surgeons to use a long-acting anesthetic, keeping the pain relief going for up to 24 hours, sometimes even longer. During this time, most patients feel comfortable, clear-headed, and alert with minimal or no need for opioids. For the patient, the difference is night and day. When they wake up from surgery, their mind feels clear. There's no nausea, no grogginess, no heavy fog. The knee feels comfortable, not numb, not paralyzed, but calm and manageable. They can begin gentle movement almost immediately, and physical therapy can start earlier, a key factor for faster recovery and better long-term outcomes. The Surgeon-Placed Adductor Canal Block isn't just a new medical technique, it represents a shift in how we think about pain control, from masking pain with drugs to preventing pain at its source. In the next part, we'll explore how this approach transforms recovery, why patients heal faster, walk sooner, and avoid the dangers of opioid use altogether. After knee surgery, the first few hours are often the hardest. Patients usually wake up feeling heavy, nauseous, or dizzy. The pain can be intense, and the fog of opioids makes recovery slow and uncomfortable. But for those who receive a surgeon-placed adductor canal block, the story is very different. When these patients open their eyes, they feel clear and calm. The mind is awake, the body relaxed. The knee is surprisingly comfortable with only mild pressure instead of sharp pain. There's no sickness, no dizziness, and no confusion. It feels like their body is healing naturally, without being trapped under the weight of strong drugs. In the recovery room, nurses notice the difference right away. These patients are alert, talking, even smiling. Within a few hours, some are already moving their legs gently. The muscles still respond normally because the nerve block affects only the sensory pathways, the ones that carry pain, not the motor function. That means the patient can begin walking with support much earlier than usual. Physical therapy starts sooner, too. Early movement is vital for knee surgery recovery. It reduces swelling, prevents stiffness, and helps restore joint function faster. Because the pain is controlled, patients are more confident and less fearful of movement. They can focus on healing, not just surviving the pain. Doctors also notice a remarkable benefit. These patients rarely need opioid pills after surgery. Instead of taking strong painkillers, they might use simple anti-inflammatory medicine or mild analgesics. This not only avoids side effects, but also protects them from the risk of addiction that so often begins with postoperative pain treatment. Studies from hospitals using this method show consistent results. Patients with adductor canal blocks report lower pain scores, shorter hospital stays, and higher satisfaction. They sleep better, eat sooner, and recover faster. Families notice the change too. Loved ones see their relatives recovering without fear or confusion, able to walk and smile the same day. The surgeon-placed adductor canal block represents a quiet revolution in pain management. It's not just about medicine, it's about giving patients control over their recovery again. Instead of relying on opioids to mask pain, this method targets the source directly, allowing healing to happen naturally, clearly, and safely. The era of opioid-free surgery is not a dream, it's already here. With each operation, more patients experience a recovery that feels lighter, faster, and safer. A recovery where pain is controlled, the mind is clear, and life after surgery begins sooner than anyone thought possible.